I didn't come here intending to say anything, but as I listened, there were a couple things that came to mind. I believe I heard you say we no longer have a pediatrics facility in our hospitals. And that made me wonder why it is the Department of Health might say it's okay to not have a facility to take care of children who are alive, well, already born, but we are going to demand that you have a facility to kill children before they're born. I don't understand what would happen in a community if we didn't provide the reproductive facilities, since it's okay to not provide facilities for children who are already born here. I don't understand the difference there and how the Department of Health can say you must have one, but not say you must have the other. And where do you go to get those? Where do we go now for our children who need hospitalization? Do we have to go across the river to Poughkeepsie? Well, then what's so hard about, first of all, you've got a facility there on Vauxhall Avenue. It's up to them to make it work for themselves. It's not up to us to make it work for them. And if that doesn't work, so you do the same thing that the pediatrics are doing. You find a community where it is. So that's part of my question. The other part was, people have been asking you what the plan is, and I feel like it's Mr. Lundquist, right?
Yes.
I feel as if you've been taking lessons from Nancy Pelosi. You have to approve the plan before you can know what's in the plan. We are the people who are paying your rather generous salaries. We have been paying for all of this through our taxes, and yet we're not allowed to know what is in the plan before it's approved. It seems to me we're being treated as if we are incompetent children. And my question is, who are the incompetents here? An alliance that couldn't look 5 years down the road? Any business that can't look 5 years down the road and have a plan and be able to adapt to what they see coming is in a lot of trouble. They're not going to last. Makes me kind of wonder about who should be lasting here and who shouldn't. And you also said you were going, that when you saw things that were changing, you kept on going anyhow because it was in the plan, rather than adapting to whatever the changes were. So I can't say that I have an awful lot of confidence in the Healthcare Alliance and what it's going to do. That's.
If you could briefly discuss the rules and regulations and guidelines and requirements that's put down by the Department of Health, and why would they tell you it's okay not to have a pediatric unit here, and why would they tell you that it's necessary for you to continue to provide a full range of reproductive health services? What goes into that decision-making process?
I believe Cynthia talked earlier about the fact that they expect you to be full service. They don't demand that you provide it, meaning from the by the physicians. I mean, for instance, pediatric care. I agree with you. A community hospital without pediatrics is a tough thing, but the reality of the world, it is such a specialized level of medicine. Getting physicians to be able to support it is very difficult. And typically what you'll find is in academic-based centers where they have pediatric programs is where you will find the level of experience, clinical expertise to effectively treat pediatric patients. Growing up, general physicians took care of everything. Not so anymore. It is so specialized that it is essentially not practical for a community hospital to maintain a pediatric center because the reimbursement that is so low that from a viability perspective, it's very difficult. And more importantly, it's access to the expertise to support it. And that comes from the level of physician support that is available. So it's primarily driven in the area of pediatrics by the availability of physicians.
So that's an availability that the Department of Health is aware of statewide, not unique to the Hudson Valley or Ulster County.
That's nationwide.
Nationwide. And also pediatric medicine, pediatric care has changed to become a highly specialized field as opposed to what you and I might remember when we were kids and the ward was filled with people recovering for 4 or 5 days from their tonsillectomy. Right? They don't do tonsillectomies anymore, right?
Right.
And if they do it outpatient.
Exactly.
Okay. The last speaker is,
Wait, you have a question about the
I'm sorry.
Why is that different from abortion?
Well, he did answer it. He said that pediatrics was an area where there is a professional shortage, that it's an area that's become highly specialized and is now centered in tertiary care facilities largely. And that's not the case with reproductive health services. I thought that was the answer.
Except that you can't find somebody to man the facility on Foxhall Avenue. That's not specialized, that's a specialized, my goodness. I think you're giving us fuzzy answers, I'm sorry.
Well, okay. I think he did answer it adequately. I think he answered it completely, that the Department of Health makes its determination based upon the availability of providers. It certainly is difficult to find doctors who will provide surgical abortion services. It is very difficult. It's becoming more and more difficult every day. But it is not the same highly specialized field that pediatric medicine has become, and it's not centered in tertiary care facilities as pediatric medicine has become. If I just give you an example, I don't know how it is today, but I know 25 years ago, I spent a lot of time in the pediatric ICU in Albany. And it was a very highly specialized area at the time, but there were pediatric units in all the local hospitals. I believe that the kind of kids that go in the hospital today who would wind up in a pediatric unit are the kind of kids you would have seen back then in the pediatric ICU or in the pediatric unit at Albany Med, not the kind of kids that you would have seen in the bed next to you when you had your tonsils taken out when you were a kid. So I think that's the big difference. Our last speaker tonight is Sister Mary Feehan.